Hi, I'm Dr. Charles Newby, and I'm located in Iron River, Michigan, in the heart of the UP. I've been in practice for about 30 years, and I specialize in clinical nutrition, endocrinology, and neurology. And we like to deal with more difficult and different conditions that don't always respond to different conventional treatments. What we're going to talk to you about today is headaches. Headaches are definitely not normal. A lot of people think, well, I got an everyday normal headache. But as if we want to be healthy people and feel good, we certainly shouldn't be having lots of headaches. What makes our approach to headaches different? Well, number one, we're going to look at you as an individual. We're going to look for the cause of your headache. We're going to try to solve that problem. We're going to try to get to the root cause of that headache, or whether it be tension headaches, migraine headaches, or different kinds of pressure headaches. We're going to be looking at your nervous system and looking at you metabolically. So, what are multiple causes of headaches? It seems like a lot of people out there just seem to have a headache, and it's easy just to cover it up with a medication or aspirin or something like this. Or they're trying one migraine drug after another, even to the point where they're taking epileptic type anti-seizure medications to stop the headaches. But this is not really getting to the root of the problem. I can tell you one thing, the cause of certain headaches are not a Tylenol deficiency. I can tell you that for a fact. But we're going to talk about some of the basic headache problems and causes. We won't have time to cover all of them, and you'd probably be pretty bored with all the details anyway, so we're just going to cover the common ones. Number one, you can get headaches from food allergies, food sensitivities. Some headaches can react to certain types of foods that our body may not be digesting or breaking down. We have different testing methods to check this out. We can find out how your system is reacting to those certain foods. Sometimes we can do that by the blood or by the stool. So there are some foods out there that are very high sensitive to certain people, such as wheat, your grains, your gluten, sometimes dairy, sometimes soy, yeast. So we want to make sure that your body's not reacting to those things. The other thing is, how well is your liver and gallbladder functioning? If you have a liver that's full of poisons, full of toxins, and your gallbladder is not flowing properly or breaking down certain foods, your body can have a reaction to that. You can also have a headache reaction because of those toxins circulating through our system. Hormone imbalances. We see lots of men or women, especially around the cycling part of your period. Hormones are changing like this. Some women get reactions of headaches from this. Thyroid is a biggie. Sometimes if the thyroid is under function, a big clue sometimes with thyroid problems is that you're waking up early in the morning with a headache. And we see that too with a lower body basal temperature. You'll wake up in the morning, you'll have a pretty pronounced headache. It may wear off during the day, may not wear off, but your thyroid works with your metabolism. It's a correlation between that and different headache problems that we've seen. How many of you have been tested for heavy metal body burdens? Now what I mean by that, we're exposed to so many toxins out there. Nowadays we see aluminum in our system, and aluminum comes from many, many sources. Deodorants, aluminum cans, toothpaste. Sometimes we'll see arsenic poisoning, we'll see mercury from our teeth, cadmium, high copper. A lot of these toxic metals or minerals actually can influence the function of our nervous system quite dramatically, which can also participate headaches. So we want to check that out. We get that through a hair analysis. That's probably our most easiest way to take a type of biopsy to look at those heavy metals. The other thing that as a chiropractor, we want to look at nerve pressure, structural alignment. Have you ever heard of people getting headaches from the TMJ, the jaw being out of alignment? Or sometimes a problem within their cranium or cranial nerves, or sometimes a bone or vertebrae being out of place, pressing on those nerves. All those things can create pressure on the nervous system, pressure on the spinal cord, and cause headaches. So we'd be checking those things out too, to make sure you don't have any of those problems. One other thing is that blood sugar dropping low, blood pressure dropping low, being sensitive to sugar or carbohydrates. How many of you have said, well, if I haven't eaten for a while, I start getting shaky, I start getting lightheaded, I'll get a headache, I'll feel poor energy. That's when that energy will drop, the blood sugar will drop, less oxygen to the brain, that'll give you a headache also. We'll talk about the 5 headache relief misconceptions. Over-the-counter meds treat the cause of your headaches. Not true. Headache medications can harm you. We know lots of people with lots of side effects from prolonged use of all these medications that they have used from headaches. Kidney damage, liver damage, heart damage. So we want to try to eliminate or cut down on as many of these medications as we can. Headaches go away on their own. Sometimes they don't. Sometimes people have long-lasting, chronic headaches that they've had from years, and they just really haven't got to the source of them. All doctors know is basically how to treat headaches. Your problem is always where your pain is. Not true. Like we talked about, the headache causes that we talked about, it could be coming from other types of problems. It doesn't always, just because the symptom is resulting in a headache, that doesn't mean that's the cause. So how do we treat headaches? What kind of things do we do? Well, first of all, we want to make sure you are breathing and getting enough oxygen. A lot of us are oxygen deprived. We don't get enough exercise. In our office, we'll have people come in and we'll give them some extra oxygen with one of our oxygen concentrators. We'll have them do EWOT, that's exercise with oxygen therapy. That'll help drive that oxygen from the bloodstream into the tissue. There's many good research articles out there how improving oxygen into the brain, into the tissues, how much that decreases headaches in the body. We'll be doing spinal adjustments, realigning the neck, realigning the spine, taking pressure off the nerve. We'll be making sure that TMJ is in alignment, the jaw joint, making sure that all the skull bones are in proper alignment, and making sure all the cranial nerves are working properly. Other things we might do, and sometimes we might do different vibration. Have you do different kind of smells through different types of scents to one side or the other nostrils, because that fires up different brain activity to different parts of the brain. We might have you do some auditory stimulation in one ear, which is also going to fire up different frequencies into the brain to make that part of the brain also function better. Through all these different causes that we've mentioned, how do we treat some of these? Well, for finding that possibly you have a toxic liver or a gallbladder not working right, we may put you on a natural formula to clean out that liver, flush out that gallbladder, get those toxins out of the body. We may put you on what we call a chelating nutrition to pull those heavy metals out of your system. Basically, we would do this naturally. We'd do this through natural formulas that are specifically designed for your specific type of problem. So if you had an underactive thyroid, we would give you some type of natural formula to get that thyroid working back the way it should be. We may change your diet. If we find some offending foods and some sensitivities, we're gonna change that. We're gonna get you on the best diet that's going to be best for your type of situation, and no foods that could cause a headache to react, or foods that you may be sensitive to. And of course, last, which a lot of people don't like to do, is improve your exercise. Get that exercise, get you moving, get you breathing, getting other more oxygen in your body. That'll help remove toxins, and also water. Increase that water intake, pure water, not water that's been saturated by chlorine or fluoride or other chemicals that could affect your body from not functioning good. So mainly our approach is going to be different. We're going to try to correct your problem as natural as we can. We're going to try to get to the cause. And our first step here would be to see you, see if we can help you, evaluate your situation. What we're offering through this DVD and program, actually your first visit here would be at no charge. Your first consultation would be free. We'd sit down, we'd go through your history, we look at all the possibilities of what's causing your headaches and get to the root cause of that problem. So the good news is we've helped lots and lots of headache sufferers. We've solved their problem, we've gotten to the cause, and they're sure living a lot better and more medication free because of it. So I'm Dr. Charles Newby again. We'd like to give you this offer, and you can get in touch with us a couple different ways. My number is 906-265-5175. You can also email us, and we will respond to your email. We'd be glad to send you more information, send you more in-depth information off this DVD, a report. And our email is NewbyDC@yahoo.com, or you can also look at us up on the web on www.newbydc.com, and be sure to check out our office tour. Just click on the office tour that's on our website. Lots of testimonials. Click on some of those testimonials and look at some of the patients we treated and how their lives have changed too. So thank you very much for watching this DVD, and we sure look forward to seeing you.